We'll try to keep this brief for everyone so they can get to their families and dinner and everything like that. But today we'll be talking a little bit about Inspire, which is a surgical treatment for sleep apnea. Let's see here. And I am required to read this. So we are recording this meeting, and Inspire records these meetings for future use, including potential for rescreening in the public forum, similar to one of these talks. While speakers will take questions from the audience, we ask that you do not share specific details about your case or ask questions that seek diagnosis or treatment. Rather, your questions should be about the indications, risks, benefits, etc. for Inspire therapy. Talking to the speakers does not replace medical care. The speakers are only providing general information and are not providing you with personalized medical or healthcare services or advice. Please be aware that you are electing to ask the questions in a public forum over a platform that is not HIPAA compliant. Accordingly, any information you provide about yourself during this meeting will no longer be private. So, and I'll also ask that you save your questions for the end. If you have anything that comes up throughout the course, just write them down, save them, and I'll answer everything in turn at the very end of the presentation. Should be pretty brief though. We'll get through it fairly quickly. So to ask questions at the end, kind of hover your mouse over the lower half of your screen. There should be a little bar that pops up. There's a Q&A button. You'll click that, you'll type your question, and then we'll answer that in turn as we get to them. You can see the little Q&A button there. So what is obstructive sleep apnea? I'm sure everyone who's attending this meeting has some idea, but essentially, the back of the throat is not open appropriately while you are breathing at night. The tongue, the soft palate, the nasopharynx, the oropharynx, base of tongue, they all are collapsing and preventing appropriate airflow during the respiratory cycle or the breathing cycle. Over 20 million Americans have moderate to severe sleep apnea. And for a long time, there have only been a couple options for it to treat it. So we're kind of happy that we can provide more options now. So in terms of apnea, there's an example here on this little chart. Essentially, there's cessation or stopping of the airflow, and then in turn, deoxygenation of the blood. And sometimes these deoxygenations can be pretty serious. I mean, they're showing 84% oxygenation. Typically what we like to see is above 92, 93%. So sometimes when patients have an apneic episode, this is one that's obviously 86 seconds long. That's a long time not to breathe. And so oxygenation can't get to the brain, to the heart tissue, to the other organs. It's a big deal. So consequences of untreated obstructive sleep apnea, you hear about the bed partner, the snoring, I have to sleep in a different room than my wife, that type of thing. There are also other things, daily fatigue, diminished productivity, kind of that brain fog we hear about, potential for accidents while driving. We see a lot of patients with obstructive sleep apnea who have CDLs, and they have to make sure that they're appropriately treating their sleep apnea to maintain their CDL. And then, of course, there are other health risks like heart and lung disease, also potential for stroke and heart attack, atrial fibrillation, AFib as we call it, many other things. So going untreated obstructive sleep apnea is not a benign disease. It's something that we definitely want to treat if we have the opportunity to. So like I mentioned beforehand, for a long time, the mainstay of treatment for obstructive sleep apnea was CPAP therapy. And to be honest with you, a lot of patients do really, really well with CPAP. There are numerous patients who come in, we fit them with a CPAP machine. They do really well. They come in for their yearly checks. They get their compliance studies done, and they stick with CPAP for the long term. But that's not everybody. And there are a lot of patients like the people who are attending this meeting who just can't get used to it for whatever reason. There are a bunch of different reasons. You could be claustrophobic. You could have difficulty with a beard and your facial structure and having leaks with the mask. Sometimes you're a belly sleeper and it just doesn't work to have a hose attached to your face all night. And occasionally some people just, they feel like the mask is keeping them up at night, or they're just moving around too much with it. It's not giving them good quality of sleep. So other alternatives to sleep apnea in the past have been oral appliances. The dentists can fashion some custom-made mouthpieces or dental splints that will help pull the jaw forward and open up the airway subsequently. That's effective in some cases, probably better in mild to moderate sleep apnea, not necessarily moderate to severe, but it can work. And I've had a couple patients where we've done some work on the nose and done a dental appliance, and they do really well with it, but that's not everybody. In addition to that, there were older surgical techniques where we would go in and say, remove the tonsils, take out part of the soft palate and the uvula, and essentially alter the anatomy in the back of the throat to see if we could improve the airflow. And what we found is, unless you have a very, very select or a specific type of patient, that type of surgery doesn't really work very well. And so we've kind of gotten away from a lot of those surgeries. You might have heard of things called a UPPP or UPPP, that kind of stuff. We're just not doing it anymore because we have found that it's not really effective in the long term. So we're glad that we have another option now, and that option is Inspire. And essentially what it is a hypoglossal nerve stimulator, or a stimulator that works on the tongue muscles. And it is a safe, pretty brief outpatient procedure. And essentially you activate it at night. It works with your breathing cycle. And in the morning you turn it off and go about your daily business. And I think there's a little video here, and I'll kind of narrate as we're going through. So at night, this guy's getting ready to go to bed. He's got his remote. He activates his device. And things have changed a little bit from what we're seeing here, but essentially there's a small breathing sensor that is implanted in between the ribs. And let me go back here for 1 second and pause it. You can see a breathing sensor a little bit further down on the chest, and that is sensing the movement of the chest wall as you initiate a breath in your respiratory cycle. And that in turn sends a signal to the battery pack and to the lead that's going around the hypoglossal nerve, the wire that's going around that nerve, to push the tongue forward. And you can see kind of an animation of that. As he breathes in, it stimulates that nerve to the tongue and moves the tongue forward. And subsequently, it opens up the airway in the back of the throat, as opposed to a CPAP machine, which is essentially just inflating a balloon. It's blowing up the back of the throat with a bunch of air. And so we've got a little clip here, and hopefully the sound will play. Gabe, if the sound isn't playing for you, just let me know. But this is a little news spot that was done around the time that this was FDA approved on CBS. So let this play for a minute.
I'm not hearing it.
You're not hearing it?
No.
Let me see if I can. It's coming out of my computer. I don't know. All right, let me see if I can adjust this at all. And if not, I can just kind of give you the gist. It works.
See if there's anything I can do on my end.
Yeah, I don't know. I've got the volume cranked up on my computer, and I also have the volume cranked up on the little screen here for the presentation. Let me try it one more time. Can you hear it?
No.
No? Okay. That's okay. Not a big deal. Essentially, it's just a little kind of vignette about a patient who's a nurse who ended up getting one of these because she just did not do well with her CPAP machine. And we can talk more about kind of ins and outs of it as we go along here, but just kind of a cool story. Sorry we couldn't hear the sound there, but that's okay. We'll move on to the next one. So essentially, we're going to talk a little bit about trying to see if I can move my screen here so I'm not blocking myself. We're going to talk about the procedure itself. it used to be, and you can see on this picture that there are three little spots. You can see the two green circles, one for the lead that's going to the tongue, one that's going to a respiratory sensor that's going down onto the chest wall, and the battery pack in the center itself. And it used to be that we did 3 incisions, and there was one up on the neck, one on the chest wall, and then one underneath the armpit. And recently we've actually found that it's just as effective to just do a 2 incision approach. So we've actually eliminated one of the incisions. Both incisions are about 2 inches long, 5 centimeters or so. Like I mentioned, one goes right underneath the jaw on the right side, and then one is right on the right chest wall. And then the respiratory sensor, the little lead that goes in between the ribs, is actually buried underneath the battery pack on the chest wall. It's a pretty quick recovery. Most patients do not require any narcotic pain medication. We typically just do ibuprofen, Tylenol for post-op pain medication. I've had a couple patients ask for narcotic pain medication because they were really worried about having a lot of pain with it. And both of them told me afterwards that they did not end up using it. So it's typically a very smooth recovery for patients. A little bit of swelling in the neck occasionally, a little bit of discomfort with moving the neck or with moving the tongue, but typically patients do pretty well with it. We request that you don't do anything strenuous for a couple weeks afterwards. Not that you can't get up and go out and do things, but that you're not lifting a bunch of heavy weights or straining or anything like that, usually for about a week or 2 after the procedure. The battery pack itself, it lasts about 10 to 11 years. And at that time, when we go back to replace the battery, it's a much shorter procedure. So the initial procedure usually takes about anywhere between an hour and a half and 2.5 hours to place the device. But a battery replacement should only take about 45 minutes. We essentially just open up the chest wall incision and replace the battery, plugging in the new leads to a new battery, and close everything up, test the circuit, and we're good to go. So much quicker. The device is MRI compatible. There are certain things that you cannot get MRIs of when you have the device, but there are certain areas that you still can. So head, neck, and extremities are all okay. At this point, it's conditional, so they're still looking at MRIs of the chest as well as abdomen and the spine and in the thorax and abdomen. So hopefully in the future, we'll have more data on that and it will be totally MRI compatible, but at this time it's conditional. So there are certain, so if say you always are getting low back MRIs for spinal issues, then that it may not be the best solution for you. But as of right now, we're looking into that data. In terms of office visits, you will come to see me essentially for your initial consultation. And then after that, we'll have something called a drug-induced sleep endoscopy, which we can talk about a little bit about, and then implantation of the device, if you meet criteria, and then activation of the device about 4 to 6 weeks after the surgery. And at that time, they not only turn on the device with the pulmonary doctor who you'll be following with, but they also show you how to use the remote. And then typically about 3 months after the device is placed, we get a sleep study with the device on, so we can see kind of how you're using it and titrate it or adjust it to you, so we have the right level for you to effectively treat your sleep apnea. And this is once again another video. He's just showing that there's the device there, they're testing it and programming the device in the office. And you can actually see his tongue will move. Well, maybe not on this one, but giving him his little remote there. So in terms of clinical data, this was FDA approved probably 8 to 9 years ago. It went through something called the STAR trial, which was the initial FDA trial. In terms of results, there is a significant and sustained or long-term benefit in terms of sleep apnea reduction in the patients that they saw in the initial STAR trial. So they were looking at a 79% reduction in overall AHI. So AHI is the apnea hypopnea index. That's the number of times an hour that you stop breathing. So whenever you get a sleep study done, they'll say, oh yeah, you stop breathing this many times an hour. That's what that number is. And so what we typically wanted to see in the past with any sort of sleep apnea treatment was a 50% reduction to call that good therapy. So if we had a patient, say, who came in with an AHI of 40 and we put them on a CPAP and they got to an AHI of 20, we'd say, yeah, that's good treatment because we've seen a 50% reduction. So there's a reduction in all the complications that we talked about earlier. Fortunately for Inspire, it's even better than that. And most patients, in fact, the ones in our patient population, Fort Wayne, so far, we've had really, really good success with multiple patients under the limit to call it even sleep apnea anymore, and essentially a cure for sleep apnea. In the original trial, they saw that their average AHI was around 29. So that's about every other minute you stop breathing. And after the Inspire was titrated, or adjusted for the patient, they had 6 events an hour. And for reference, 5 events or less is considered normal for an adult. So excellent results in terms of reduction of sleep apnea. In addition to that, this is something we get questions about a lot. So bed partner satisfaction with the device. So we still get a lot of patients coming in saying, you know what, the CPAP's making a lot of noise, or I can still hear them snoring through the CPAP. And in the initial FDA trial, the STAR trial, they showed an 88% reduction essentially in bed partner disruption at night. So the bed partners were not hearing the snoring that they typically did, and they were not disturbed by the partner's sleep. So excellent results from that standpoint. In terms of satisfaction from patients, there was essentially across the board positive feedback. 94% of patients were very, very satisfied with their treatment. And in addition to that, we look at their adherence. So using any sort of sleep apnea device, we want to see at least 4 hours a night of compliance with the device. And in the initial STAR trial, they saw that patients were using their device on average at least 5.7, almost 6 hours a night. So that's excellent use of the therapy. It means that they're liking it and they're using it. This is just a little blurb that talks about the STAR trial. And as of right now, there are over 100 peer-reviewed publications that have supported the Inspire device. The 5-year trial data for the STAR trial was published in the New England Journal of Medicine, which is a pretty big deal journal in the medical community. And as of right now, they're gathering data for the ADHERE registry, and that's essentially just a follow-up measure for all of the patients who have had the Inspire placed. So they're trying to look at long-term data to make sure that this is continuing to be an excellent method of treatment of sleep apnea. In terms of insurance coverage, that's a question we get pretty frequently, and that is actually improving every day. So a few months ago, we received notification that Anthem is now covering this in full, as well as Aetna and Medicare coverage as well. And many VA hospitals and military hospitals are also covering this benefit. So it is very well covered by insurance. And it's one of those things that we have a team that works on getting your case submitted and hopefully approved. We have seen very, very few insurance rejections, and when we do, we resubmit, and almost invariably we get the patients the device. So is Inspire right for you? That's a good question. There are some criteria that you have to meet. So not just anybody can have an Inspire device. The first and foremost thing is you have to have tried CPAP. So the patients who try and fail CPAP for whatever reason, That's the first step. So if you cannot tolerate CPAP, whether you're claustrophobic, whether you're a belly sleeper, whether you travel a lot and you can't keep your CPAP with you because it's difficult to get it on the plane and things like that, that's one of the criteria. The next criteria is moderate to severe sleep apnea. So what that is, we talked about the AHI, or the apnea hypopnea index, the number of times an hour that you stop breathing. That should be between 15 and 65 for a person who's wanting to look into an Inspire device. And then you cannot be significantly overweight. So the BMI requirement for most insurances is less than 35, and that depends on your height and weight, and that can be calculated. But for most insurances, it's less than 35. For certain insurances, I believe Aetna and then maybe Anthem, I think it's 32, but that's something that we work with you on. I've had a couple patients where they were over the limit and they said, you know what, I'll call you back when I'm ready. And guess what they did? They lost the weight because they knew that this was the best way to treat their sleep apnea. And they were motivated to lose the weight to get the device, essentially. And then the next step, if you qualify from all of those other categories, is something called a DICE. And I had mentioned that a little bit earlier. That's a drug-induced sleep endoscopy. And that's a very brief outpatient procedural exam where we give you a small amount of anesthesia, similar to if you've ever been under for a colonoscopy, where we take a small telescope through the nose and take a look at the back of the soft palate, the back of the throat, the tongue, and see how things are moving. And what we want to see is good anterior, posterior, or front to back collapse in the back of the throat, meaning the tongue and the palate and everything are just falling straight back. If we see that, we know you're a really good candidate for the Inspire, because essentially what we're doing is pushing that tongue forward with the nerve stimulation. If we see a bunch of sidewall collapse, we know you're not a good candidate for it, because we can't really control those sidewall muscles as well as we can control that front to back movement. And then obviously age range for criteria is 18 and over. In terms of more information, inspiresleep.com has information about the device. They've got a bunch of patient testimonials. They also have images of pictures of incisions, kind of further out through the healing process. And there's also information about the ambassador program. So patients in your area or in Indiana who have had this done and are willing to kind of reach out to new patients who are considering having this done. Really great resource. Most of our patients are pretty darn happy about having their device, and a lot of them are very vocal about that. So they're willing to talk to new patients who are considering this as an option. If you're considering scheduling an appointment to come talk to either me or Dr. Yalamanchili, one of my partners, we both perform the procedure. You just have to call our office and we can get you in to be evaluated and make sure you meet those criteria. I mentioned earlier that you have to have a sleep study. Typically that's within 2 to 3 years of initiating this whole process. So if you've had a recent sleep study, then we can use that oftentimes. Occasionally, we don't see the right data on it and we have to order a new one. But if that's the case, we can do that for you. We order our own sleep studies all the time and we can get that squared away. In terms of the app, essentially for tracking, there is an app, and it also has a little bit of information on the device and further information, patient testimonials and things like that. So similar to inspiresleep.com. And that's, I think, all we have in terms of just a brief overview of